So my name is Rob Weshsler, and I'm a scientist at the Sanford Burnham Previs Medical Discovery Institute in La Jolla. I'm also director of the Clays Center for Neuro-Oncology and Genomics Research at Rady Children's Hospital. And in the context of this trial, I serve as a scientific director. We're really excited to be involved in this trial and incredibly grateful to the Swifty Foundation for their support. This is a trial that's born out of the research that we've been doing in my lab for several years now, trying to investigate the role of the immune system in controlling pediatric brain tumors, and in particular medulloblastoma, and more importantly, trying to use that information to develop more effective immunotherapies for pediatric brain tumors. The work that we've done in our lab has suggested that one of the reasons that the immune system normally does not attack medulloblastoma is because the tumor is smart, and the tumor shuts off one of the key molecules that the immune system needs to recognize the tumor and kill it. This is a molecule called MHC. And what we found is that if we treat with a drug called tumor necrosis factor, or TNF, we can cause the tumors to re-express that molecule. That is, to go from being invisible to the immune system to being visible again. And in our mouse models, when we do this, we treat animals with what now has become standard immunotherapy. That is an immune checkpoint inhibitor, which can rev up the immune system so that it's more active. That in and of itself has no impact on tumor growth. And that's because the tumors have found this way to render themselves invisible. If we treat with TNF first to make the tumors visible, and then we treat with the immune checkpoint inhibitor, now we get a very significant effect. In fact, the mouse's immune system can completely eliminate this tumor, and the mouse is now tumor-free. We've never seen anything like this in our 20 years of investigating medulloblastoma therapies. And so we're really excited about the possibility of testing this approach in patients. And that's what this trial is designed to do, to give patients with medulloblastoma a shot of TNF followed by the immune checkpoint inhibitor, and do this repeatedly and see whether that can eradicate their tumors the way it worked in mice. One of the unique things about this trial is that we are determined, of course, to make this work, to try to cure patients, but at the very least, we're determined to try to learn from the experience so that we can design the next trial better. And so the way we've put together this trial is what's called a biopsy treat biopsy approach, where we take a sample of the patient's tumor and we look to see whether it has made itself invisible to begin with. And then we treat with TNF and we look immediately afterwards to see whether we have now made it visible using TNF. And if that works, that gives us hope that the therapy will improve outcomes in kids. If that doesn't work, it gives us incentive to try to figure out why. And so these two features of the trial, this novel approach to trying to enhance immunotherapy, and this really critical aspect of trying to design the trial so that we can learn and design the next trial better, are really what's unique about what we're doing. We're hopeful that this trial will launch in the next few months. It's done through an incredible consortium called the Pacific Pediatric Neuro-Oncology Consortium, or PNOC, which is known for doing cutting-edge, really well-designed trials in kids with brain tumors. And we have incredible support from the Swifty Foundation and others that really has made this possible. And so we're very hopeful and we're very excited. And thanks for your support, Al.